Let's meet our MVPs, leading the fight against an unseen enemy with their expertise on the battlefront, leaving their families and working extra shifts. This is where it starts for those treating COVID-19 patients directly here at the University of Ghana Medical Center. They have to first protect themselves by donning the appropriate personal protective equipment, popularly known as PPEs. Here at the regular treatment area, Dr. Emmanuel Amoa and Dr. Ama Edwin have to do this.
We are going to wear our full PPE. The reason is simple. When you go in there and then anybody needs any care, because we are in full PPE, we can offer the level of care, the needed care for every patient. If you are not fully donned, then when you go in, there may be some procedures you may not be able to do because you are not in the appropriate personal protective equipment.
I'm looking forward to see how the donning is done in, the appropriate ways of, donning the PPEs,
So there are protocols, and the protocols have steps. So the steps will be followed. So we have supervisors here whose sole responsibility is to make sure that healthcare workers are donned properly before they go to offer service.
Check if there's any hole somewhere, any tear, anywhere.
So it's been a few good minutes, trying to get myself in this. I have to tell you that it's not an easy process. My camera technician, Sami Asante, is here with me. Sami, are you sure you can breathe?
I'm managing.
This is a laborious process and takes more than 20 minutes to don the full PPE here.
You can't just go in. For every patient you have to see, you have to plan. You have to plan the care. What exactly are we going to do in there? So that when you go in with, let's say, a doctor and a nurse, you'll finish all that has to be done for the patients before you come out.
We'll try as much as possible to give you a best eye view of what a day in our life here in the context of COVID-19 looks like. You're welcome.
Thank you very much. We are absolutely pleased to meet all of you. The situation at the intensive care unit, though similar, requires even more protection for obvious reasons. Dr. Daniel Soti and Dr. Emma Enima Adai of the intensive care unit have to don before they go inside the unit to offer patients there the critical care they need.
Our DDNS is going to be their supervisor for the donning, and they would also help each other don, and then we would meet them as they go in. Okay? Yeah, Emma and Daniel, you guys?
Yeah,
all right.
Let's get in and don.
When I was at the other end, it took a few good minutes, I have to say, for the donning process. I think it's the same.
Yes, it is. You need to take your time when you're donning, because you don't want any part of your body to be exposed. That is very critical, because once your body is exposed, then your likelihood of getting infected is high, and then that means you're out of commission for 2 weeks minimum. And that won't augur well for the patients that we are supposed to be taking care of.
So they have to make sure, because in their case, they are going to actually be touching patients, moving patients, adjusting oxygen delivery devices. They will definitely be in contact with surfaces that the patient has touched or had viruses have settled on. So they can therefore not be protected. If when they checked this PPE, that it was not, there were tears, they're going to just tear the whole PPE and discard into the bin. We do not take any chance at all. And that is why it is important that these are available at every time. We go in frequently. The nurse has already gone in. The two of them are going to go in, review the patients that are there, work with the nurses and all that.
such a painstaking process to go through, but for good reason.
Yeah, there are two reasons why you don't want your staff, your medical staff, and for that reason, for critical care staff to be contaminated or unduly exposed. One, because that is a risk to their life, which is the ultimate reason. But secondly, we do not have enough healthcare professionals. Anybody who's exposed, even if the person is not infected, we will not know until another 2 weeks. So if she goes in and then she's exposed because of the fact that there's part of her that is done, then what that means is that when we doff her off, we're going to quarantine her for the next 2 weeks. And that means one of our limited staff already gone.
At this stage, we have to go back to perform hand hygiene. And we have to do this till the alcohol is dry, then we wear a pair of gloves. So that's what you see us doing. And we cannot skip any step in the donning, as Dr. Wu was saying, because every step is important.
We have to do all this because in critical care, we do a lot of procedures in different positions. Sometimes you may actually have a doctor who may have to go down to help lift up something. If this is too tight and you do this and then it tears, then you're basically coming out immediately. Okay, so all that is important in making sure that they're comfortable. These are critically ill patients requiring frequent entry into the ICU, and they're requiring continuous monitoring, which we do in our monitoring room all the way through there. So all this she's done is basically she's protected everywhere, making sure that no part of her body is exposed. And this is once used. She's going to use it only single. And then when she finishes, she's going to discard every one of them. And then in another short period of time, somebody else, you can see others are preparing in there, and then they would move in. So we use this so very frequently, and that is why when we talk about PPEs required frequently, that's what we're talking about. Unlike mild areas or patients who are asymptomatic, where we can do non-contact care, in the intensive care unit, we cannot do non-contact care. We may have patients who are ventilated. We may have patients who are not ventilated, but who are very ill, severely ill, and requiring our assistance to keep them alive. And therefore, we cannot have any prolonged period of time without a staff in there. Deputy Director Nursing Service, Mrs. Eyiram Ofe Oku, and Auntie Emma, one of our senior nurses, would actually come talk to Lordina. She had gone through what she's supposed to do, but they're going to reiterate all of that again, one by one, on a documented paper, but that paper is not going to go in. So I'm just going to leave them for DDNS to take over now to explain to us what we're going to do, because that's nursing care. That's not my part.
As Lordina is going inside, there are some instructions that I have to give to Lordina to do. And Lordina have to give this patient, Mr. L, metformin, to check RBS during output and feeding. And then Madam R, you check RBS and feeding. And then Mr. M, you give a paralysis scan and an FDP. And then you check RBS and urine and feeding. Thank you.
All right, Lordina, are you okay with that?
Yeah.
So intentionally, we've not used directly our patient's name because, again, patient confidentiality is extremely important. These are patients who are vulnerable, who are very ill, but we still respect every single part of their identity, and we are ethical with their care. So Lordina knows who Mr. L, Madam M, and then whoever is. They would have agreed on all this, okay? All right.
Ready?
Yeah.
Okay, so Dr. Dai opens the glass door. Lordina walks into the intensive care unit. And if you look inside the intensive care unit, apart from Lordina, you can see that there are 3 other people. Hello, guys, don't hide. Okay? So it is not only doctors and nurses who work in an intensive care unit. There are other health professionals who are also involved in the care and even in helping with what we do. So those are 3 biomedical engineers who work with us closely whenever we need something set up, a machine check and all that. But recognize the fact that they are also donned. Yes. They just don't walk in. I mean, previously, we just give them a single gown to cover their vessel, and then they come in and work on our machine. But they have to fully don. And donning takes quite some time. But even more important is that they have to work under this condition. They have to work with all this covering their face. Sometimes their goggles are blurred because they are breathing into it. Sometimes it's quite suffocating, and sometimes there's sweat underneath it, even if it's an ICU with air conditioning and all that. So you can see Lordina is preparing. But I also noticed that Lordina is talking to them so that if she needs any help, they are biomedical engineers, but they can still help her with nursing care. If they need any help, they can ask Lordina so that we do not multiply the number of people who are exposed at any point in time, okay?
So we're going in to meet Dr. Danny and Enima here, who are carrying out the activities. Okay, so I have made it. I feel like I've won an award. I've never been to an ICU before. So yeah, welcome Dr. Enima.
Welcome, Komla, to our intensive care units for COVID patients. There are different degrees of illnesses, different degrees of infection. So as much as possible, we handle each individual patient with as much caution and care as we can. And we try not to transfer the viral load or the level of infection from one patient across to another patient.
Hello.
Hello, this is Dr. Adai calling from the ICU.
Okay.
Everything okay in the control room? All patients vital stable?
Okay. Yes, yes.
Thank you very much.
Thank you.
So that was just to demonstrate how we communicate with those outside. So as they are monitoring outside, we are monitoring inside, and we communicate with each other. If we need anything that we do not have in the ICU, we communicate the same way with them to get those items ready. Okay. And as Dr. O mentioned earlier, the care in here it's an overlapping care. Apart from medications, we have to do everything for the patients in here. We have to do nursing care, we have to bath them, we have to give them their food, we have to feed them, and we have to do hygiene, perform hygiene for them, because most of these patients are people who cannot do things on their own. So it's not just a matter of coming in and giving medication, it's a holistic care of the patient.
Okay, I see Dr. Soti. Let me just hear what he has to say.
Hello, Danny. Hello, Mr. Ace. Blood sugar is 8.5.
Mr. A.
Yes.
Blood pressure.
Blood sugar.
Blood sugar is what?
8.5.
Blood sugar 8.5.
Yeah, and we've given 500 of metformin.
Okay.
To Komla, let's go to the patient area that we have prepared in readiness to receive a patient, and then I'll go through some of the things and equipment that we use to manage the patients.
Okay, great. So let's just go.
This device here, that is what we call a ventilator or a life support machine. Okay. This hasn't been completely set up yet, but once it is completely set up, it has a couple of tubings coming in and out of it, which we use to connect to the patient. Now there are 2 ways of connecting this life support machine or ventilator to a patient. So we call it invasive ventilation and non-invasive ventilation. Now with the non-invasive ventilation, what we do is that we put a mask over the face of the patient, either covering the whole face or covering just the nose and the mouth of the patient. And then this machine blows air or forces air into the nose and mouth and then down into the patient's lungs. So if you have a patient or a person who, as a result of COVID or any other kind of disease, is not able to breathe properly, then this machine helps that patient to breathe.
Yes. You finish your rounds?
Yes, I finished my rounds. Even as we go about working, we are keeping an eye on each other. So I'm watching Daniel or Dr. Soti to make sure that his seal is intact as we move about, as he also monitors me. If at any point we notice that anybody has a break in their seal, that person must leave and doff off or take off the PPEs immediately. Okay.
So I've just been told that in a very short time they will get out of here. They've administered the care that they had to, provide to those who are here, and in a short time we all will be coming out. A few more communications here and there, and once that is sorted, we'll just move out. And remember, we have been told that once staff get in here, they do not get out because of the obvious, the possibility of getting infected.
Okay, so at this moment we finished with performing our task, and so we are going out to do what we call doffing, and we are going out with you so that you see the process of doffing.
Okay.
So we need to move, you'll be directed to the doffing area.
Okay, sure.
Now I need to mention that the duration of time you spend in here depends on the task you have to perform. There have been times when we've had to stay here for 2 hours, 3 hours. Personally, I've had to stay here for 4 hours before in this, or 5 hours. Now I don't know how you feel and how comfortable you are.
I am literally suffocating, but I can't say it.
Yeah, so imagine being in this for hours, and for these hours, not just standing, but actually busy working. And you realize that it is not an easy state to work in. So at this moment, we are going out to doff. And the doffing isn't just about just removing everything at once, as you see. We take you through the process, and you realize it's a very deliberate process, more thorough even than the donning, because the doffing is the area where you can pick up the most infection. No matter how tired or exhausted you are, you have to take your time to doff off.
Wow.
Go ahead, spray. Go ahead, spray. It's pushing. Stretch out your hand like it's here. Let's spray the cushion of the camera, of the mic. Okay, so that's fine. Okay. All right. Okay. Yeah. Okay. Yeah, go. The next line. Okay.
So it feels like I've been to battle, and back. It's not been easy, but these, health officials do this on a daily basis, really, since COVID. So I guess we have to give it up to them. It's not been easy for me. But Dr. O, we're out of that side.
How was it in there?
I've just been to war and back. Really.
All right. So this is basically what we do every day for the past 4 going on 5 weeks. Basically doing ICU, but not only just doing ICU, but doing ICU in the midst of an infectious disease, a very dreadful infectious disease. But we're getting used to it. We just, as I said earlier, on hope that this is contained.
Dr. we'll start with you, but this is more personal. I just heard you tell Dr. Ankama that you get home sometime 10 p.m. and after every day since this. That must not have been easy.
No, it's not easy. In COVID-19, you now have to not only do this, work late, get home late, but now with your family wondering whether you're getting infected and whether you're bringing infection home. It is difficult for them. You have to keep reassuring them. There are psychological aspects of this, which you have to keep reassuring them. Sometimes they feel lonely, but somebody's got to do this. And that's what we signed up for. That somebody at this moment in our history as health workers happens to be us. It would be nice to have this done, to have this virus get out of our country, to get back to what we used to do, and get back to our families. Trust you me, it would be nice.
Yeah, I miss the old days. I miss family, of course. I miss friendships and those social interactions. They really meant a lot, and we now value those interactions more now because we are unable to do them these days. Dr. Nai, I want you to just wrap up for me. How has this changed your routines outside business?
This whole thing, it's a battle of a sort. It's like war. It's like soldiers going to war. Before you leave to go to war, you have to prepare the minds of your family back at home. We've handled it differently. Some of us have had to separate ourselves fully from our family members. Like myself, currently I'm home alone. I've had to separate myself from my family members because some of them are among a higher risk group. If they get the infection, they'll be among the higher risk group. So as a first line, I've had to separate myself from my family for this period. You have to go through a ritual every day. When you get to your workplace, you have to go through a ritual before you can work. When you close from work, you have to go through a ritual. Sometimes you have to take a shower at the workplace. When you go back home, there's a whole ritual you perform. When you leave and you're going home, you cannot use public transportation anymore. You cannot expose many people to you because of the area where you have worked. So all that has also changed. Of course, our social activities have also changed. You can't, even though they say the lockdown has been lifted and some people can do certain things now, we are still on our own form of lockdown whilst we work in the treatment centers. And it is not every health worker who would accept to work in a treatment center. This is a volunteer job we are doing. We had to volunteer to come to the treatment centers. Every aspect of our lives have changed, and the psychology as well, because when a patient passes away, it is not an easy experience at all. I've heard people say, oh, you people are doctors, you've seen death so many times, so you're not affected. Trust you me, every single patient who passes away affects us. We are very, very touched by what happens to any patient. In the same way, when a patient recovers, we are extremely excited. It encourages us to keep pushing because we've seen people recover. But when we lose somebody, it is traumatic. Unfortunately, you don't have the time to spend days mourning. The next day, the work goes on. Other patients are being admitted. Other people's conditions are changing. So all we have is each other.